Hi, everybody. My name is Ronnie Brody. My BSW internship was assigned to Step Up Greensboro, a 501 nonprofit organization established in 2011 by members of the Presbyterian Church in Greensboro, North Carolina. The agency is located at 707 North Green Street, downtown Greensboro. Initially, the program was set up to serve the homeless and the needy in the community by providing meals, shelter, and clothing. In more recent years, the focus of the program changed to provide jobs for the unemployed. Now there are three Step Up locations statewide: Step Up Raleigh, Step Up Durham, and Step Up Wilmington. Participants in the Greensboro area face challenges associated with poverty, incarceration, homelessness, recovery, educational gaps, and family instability. The program believes lives can be greatly impacted through gainful employment, which would move more people towards stability. Hence, the focus changed to preparing unemployed people for jobs. The mission of the program is to motivate, empower, and equip individuals to become self-sufficient and stable through employment and life skills training. There, I work directly with clients experiencing challenges in all these areas. Here at Step Up, caseworkers and staff refer to clients as participants. I was a caseworker for several individuals of diverse backgrounds. The client I chose for the purpose of this case presentation, I will call Samuel for reasons surrounding confidentiality. Samuel is a 38-year-old Black male. Samuel came to Step Up Greensboro looking to obtain gainful employment. He currently has secured a temporary employment and is a janitor for a church affiliated with the agency. Some significant dilemmas Samuel is currently facing is homelessness, as he seeks shelter at Greensboro Urban Ministry for the homeless. One of his goals are to secure a job that can offer him stability for permanent residence. Due to placement being predominantly focused on job readiness training, I do not have extensive background on Samuel's psychological history, nor any specifics on any diagnosis. Samuel appears to be depressed, has a history of substance abuse, and is a recovering addict. During my field experience and interactions with Samuel, he shared many of his life experiences and some challenges that he faced with me. Samuel relayed that he is the third of four children, of which he has two older half-brothers and one younger sister. Samuel has little to no family support. His siblings are successful and aren't open to supporting him financially or emotionally. Samuel barely remembers his father, as he left the family when he was 5 years old. After the birth of his younger sister, Samuel explains his mother had little to no time for him, and all the attention was quickly shifted to his sister, who was deemed the golden child. Here is where I associate Adler's psychodynamic theory, individual psychology, inferiority complex. Samuel had feelings of inferiority, for one, because of the absence of his father in his early childhood and the neglect of his mother. Samuel's younger sister was considered the mother's favorite. As an adult, this inferiority evolved into superiority complex. For example, while interacting at the agency, Samuel clung to Mr. A, the executive director. Samuel has displayed defense mechanisms, a form of protection of personality, specifically the ego from the id. The use of defense mechanisms can be unconscious and helping or harming psychologically. The mechanism I noticed Samuel utilized was Anna Freud's ego psychology, specifically the defense mechanism of identification. Here, Samuel identified with Mr. A as an authoritative male figure that he respected and he admired. Secondly, the defense mechanism of intellectualization should be considered. Samuel would often intellectualize his predicament and situation, being homeless, rather than focus on opportunity for stability through the program and gainful employment. Operating as his case manager, Samuel shared with me his anger and resentment toward his parents, especially his mother. He reflected on many instances of neglect that stood out during his childhood. I believe Karen Horney's personality theory, anxiety, and culture is evident in this case. Karen Horney related developing anxieties with basic hostility, which can occur if there is disruption between the parental relationship. In this case, basic hostility can equate to basic evil due to the extent of the neglect regarding the parent-child relationship. Samuel was always made to feel a failure as his sister was considered successful and he would in turn be unaccomplished. In response to conflict, we learned from Horney that an overusage of a single coping skill can cause poor functioning known as neurosis. I would label Samuel as neurotic because he continuously uses the one coping skill of compliance. Compliance can be described as a continuous need for approval or moving toward. The overusage of compliance can become an unhealthy response and result in idealized image. However, with the acting out of compliance, this encourages my conviction that Samuel continuously sought to be seen as in good light and to gain approval from Mr. A. In reflection of Samuel's shared experiences, I believe it is necessary to involve theorist John Bowlby and his theory of attachment. Bowlby expresses that during infancy, it is crucial for young children to be close to their nurturer or caregiver. This closeness or connection, if not established by the mother, can result in a compromised attachment, affecting individuals' sense of self. Throughout my experience as Step Up as a case manager for my participant, Samuel, I found listening closely and patient without interjection allowed for a trusting relationship to formulate at an accelerated pace. As a service provider and competent social work intern, I understand my main objective is to advocate where to professionally assist him within the confinements of our policy and mission. With guidance from agency colleagues and professors, it was best to continue working with my client from the lens of a strength-based approach. I believe Samuel identified well with me as opposed to the other women in the agency, as I'm a young African-American male. Intervention techniques and evaluation strategies that were or could have been used during my time as Samuel's case manager were the following. For one, therapist Beck and the implementation of his cognitive behavioral therapy, or CBT. The CBT is a technique of intervention that helps to identify negative or dysfunctional thoughts. The ABCs, or activating event, beliefs, consequences of belief, is a model to produce healthy, negative, or unhealthy negative feeling and emotions. In Samuel's case, and once again highlighting the importance of strengths-based approach, the negative event or irrational belief leads to unhealthy negative emotions, such as his depression. The goal of this intervention is to identify and challenge the dysfunction in the emotions that he was facing. What an individual thinks will lead to what an individual does, and then elicits one's emotions, negative or positive. An additional intervention technique would be to the motivation of self-created goals. These goals were meaning to life and promote positive behavior. It is important to help promote a healthy style of life. In doing so, we can identify elements of style of life that was responsible for the problems. Therapy could be suggested where the client could feel open to discuss family dynamics and early memories. Knowing that we are social creatures, when people are respected and encouraged, they feel confident and are happier. The problems occurring from retaliation from neglect and feelings of anxiety can be combated with intervention techniques of self-analysis. The following are a few techniques to healthy ways to introspect. Reflect on childhood experiences, keep track of moods and feelings in a journal, examination of self-esteem, and examination of one's thinking patterns. Thank you all for y'all time, and I look forward to reading your comments.